I am going to demonstrate an aspiration. I've got a patient that's come in, he's had a motorbike accident 5 weeks ago. He's coming with a very swollen right knee. So I'm going to demonstrate, I'm just going to do an examination on him and prepare his knee for an aspiration. And I will show you how that all works. So first of all, we need to examine the knee and just make sure that everything's okay. You can see the knee here is swollen, there's fluid in this knee. It's warm, so there's quite a lot of heat here, so there's a lot of inflammation in the knee. There's some skin laceration here from the injury. And let's just do an examination. So I just want to see how mobile the actual knee is. So that's pulling at the back of the knee. It's okay there?
Yep.
And it's okay there?
Yep, perfect. Yeah.
And your pain's okay. Just going to straighten that leg. Just,
Yeah,
how's
that's
that
very stinging now.
yeah, at the back of
On the back. Yeah.
long here.
Yeah. Yes,
Okay. So there's also swelling at the back of the knee. Okay. That's great. So just bend this one here. Okay, fantastic. So I'm going to prepare, really use sterile technique to prepare. You ready? Okay. Good. So I have I've done a full examination of a patient. We've gone through a consent process. I've explained what I'm going to do. I'm just going to explain a little bit more of a procedure to my patient here. So I've just cleaned the area, make sure it's all sterile, using sterile equipment. I'm going to pop the needle in. You're going to feel a little bit of pain when the needle goes in, and then I'm going to try to draw the fluid out.
Okay.
It's very, very low risk of this procedure doing. It's very, very safe.
Yeah.
And do you have any questions or anything you want to ask?
No, more than happy.
Yeah?
Yeah.
Okay, I mean, the only real side effect is you can get a little bit of pain from having the actual needle put in.
Yeah.
And as I mentioned earlier, we might need to go into separate areas around the knee to get the fluid out.
Yeah, sure.
Great. Good, so let's come into here first of all. Now, often I would bend the knee first. You okay?
Yeah, absolutely fine.
You okay?
Yeah, absolutely fine.
So that's one 10mm done. It's really coming down now. Did you hear the air coming out of that as well? Okay, so I've done the aspiration and we've got a lot of fluid out of of the knee. It's looking much better. There's much less fluid. It's now a much better shape. You can see there's less bulge in here. There's less fluid sloshing around. We'll need to do another one, I suspect. But just to have a look at this is a knee that's had trauma, so this is why there's blood. Normally this would be a golden fluid. It's actually blood because of the trauma following the road traffic accident. And we've got 10, 20, 12, 20, 32, 44, 56, 66, 78, 90, 100, 112 mils, so 112 mils of blood out of the knee today.
Hello there, came to a Croydon physio today following a road traffic accident on a motorbike with an extremely swollen kneecap. Tim kindly drew off the fluid on my knee, and now my knee feels more mobile and I feel a lot better in myself, bearing weight on my knee. Yeah, definitely can't wait to come back next week and get it looked at again.